Osteoporosis, or thinning bones, is a serious condition that can result in tremendous pain with fractures. It's often called the silent disease. Dr. Pam Taxel is an endocrinologist at the UConn Health Center, and she offers us some tips to avoid the odds of osteoporosis. Doctor, thanks for joining me.
Good morning.
Good morning. So let's start off by talking about the risk factors, because there are plenty.
Yes, many risk factors. Women are clearly at risk in this disease more than men, 4 to 1. Age is a very important risk factor for breaking bones, which is osteoporosis. Losing your hormones as a woman as you age, not enough calcium and vitamin D in your diet, not enough exercise, certain medical conditions, certain medicines, smoking, the list goes on and on.
The medications caught me off guard. Which medications are we talking about? Do you know a few of them that you can pass along?
Yes, there are medicines called steroids, which are used to treat many conditions such as arthritis, asthma, those type of medicines.
Okay.
Newer medicines for breast cancer can be very detrimental to bones. Medicine for prostate cancer. So those are just a few.
Just a few. Now, women who are fit, they're active and healthy, they can be, though, walking around with osteoporosis, and they may not even know it. And that's a big red flag there. What would you recommend to people? Would you recommend that they check their bone density?
Yes, osteoporosis is clearly silent, often until you have that first fracture. But a bone density test is a way to determine if you're at risk for breaking bones.
Okay, and as far as prevention and treatment, let's talk about vitamin D and calcium supplements. They've come into question recently. Tell us why that is so.
Certainly that the calcium issue and D has been in the news a lot. Calcium for two reasons. One, there's a concern about supplements causing heart attacks. And there are some studies showing that, but they are not conclusive. And then the question is, can calcium really prevent breaking bones?
Okay.
And that's another controversy. So these two things regarding calcium, I think, are still out there. We're not quite clear, but you still do need to take adequate calcium. If you can get it from food sources, that's optimal. If not, supplements.
All right. Before we go, though, what's a common misconception about osteoporosis that you'd like to clarify, just to kind of set the record straight that a lot of people kind of get confused by?
Osteoporosis is the bones themselves that are at risk of breaking, as opposed to osteoarthritis, which is the space between the bones that undergoes degeneration.
Okay.
So they're two separate issues, treated very differently.
Okay, doctor, thanks for coming in. I appreciate it.
My pleasure.
Thanks for your expertise.